And now the Minister of Health and the Chairman National Council on Health, Osage Hanere, alongside the Minister of the Federal Capital Territory, has made public-private partnership collaboration to improve healthcare services in the country. The ministries, while declaring open the 63rd National Council on Health, said that Nigeria is oxygen sufficient. And KAFTAN TV's Benedict Oko has more.
The 63rd National Council on Health kicked off on Monday in the Federal Capital Territory with deliberation to review the status and state of healthcare systems in Nigeria. At the opening ceremony today, the Minister of Health and Chairman, National Council on Health, Osage Hanere, while highlighting several interventions by the federal government on improving healthcare services in the country, disclosed that the nation has nationwide oxygen sufficiency.
The government is exploring partnerships that will produce investment in the health sector, especially taking into consideration existing opportunities in manufacturing medicines, laboratory supplies, and health-related commodities, including also construction of medical facilities and super specialty hospitals, as well as advancement in health technology. One of such partnerships is with Afrexim Bank, for which Nigeria won a bid to host the regional center for medical excellence. Capacity for oxygen production has been greatly expanded so that in no distant time we shall be able to have nationwide oxygen sufficiency, even at primary healthcare levels, and also available to private facilities.
While declaring the summit open, the Minister of the Federal Capital Territory disclosed the need to address the shortage of human resource capacity.
If we must change the present health outcomes, which are not quite encouraging. In the last 3 years, we have built and upgraded a number of primary healthcare facilities, employed and deployed a reasonable number of nurses, midwives, and other healthcare professionals to these facilities. This is to some reasonable extent. It has improved access to primary healthcare services within the FCT. You all are aware that the human resource crisis in the sector caused by increasing brain drain has resulted in shortage of the critical healthcare professionals to manage our facilities. These needs to be addressed.
The Chairman Health Committee on Health, Tanko Sanunu, said that there is no political will for proper healthcare delivery in Nigeria.
We have also tried to review which is currently in the Senate, the act that establishes the National Primary Healthcare Development Agency. We are just a little harmonization that remains for it to be sent to the President. And in that act, we have tried to provide a legal framework for the primary healthcare under one roof. For us to achieve what we desire, two things are necessary. And please let us see. Full operationalization, I'm not saying partial, full operationalization of National Health Act 2014.
The representative of the World Health Organization, UNICEF, and the World Bank called for the addressing of the disease burdens in the country.
Colleagues, Nigeria is very delayed in the last one in terms of demographic transition. That reaping a dividend is almost a challenge. The second one, the health financing transition, even worse. Out-of-pocket expenditures is 72%. Spending per capita is $15 per person, one of the lowest in the world. And the disease burdens, we have not addressed much, but then we get all of these complications. So it means then that this kind of meetings is one where we would need to profile innovative and real-life solutions to make a difference.
The Health Council, being the highest policy-making organ in the health sector, saw commissioners, directors, and permanent secretaries from the 36 states of the Federation and the FCT paving ways towards successful universal health coverage initiative in Nigeria.